about my grade, not worried about stuttering, not worried if I'm going to bore you or not. But if all I'm doing up here is wondering, why am I so ugly? I could just kill myself. Maybe if I wasn't so short, my face so unproportional, maybe then I'd be pretty to all of you, to myself. But I wasn't pretty before I checked in the mirror before class, when I woke up, or the 15 times in between. Now, this could sound ridiculous to you, but that is a constant reality to the people dealing with BDD. The Diagnostic and Statistical Manual of Mental Disorders defines a body dysmorphic disorder as a preoccupation with an imagined effect in your appearance. This defect must cause significant distress in your social, occupational, and other important parts of your life. Now, I'm going to stress to you the importance of diagnosing this mental disorder because it can consume you. It could take over your whole thought in life and you don't even realize what's happening in front of you. And I hope that I can make you realize what the disorders is by first telling you who can be affected and why, telling you the symptoms and behaviors that a person with BDD will show, and lastly, that there are treatments available if you or someone you know is affected. In a world where looks mean everything, whether you're a man or woman, it could be so easy to get caught up in trying to be perfect for everybody else. And that is why, whether you're a man or woman, it doesn't make a difference. And age truly doesn't make a difference either, nor culture or your ethnicity. Everybody believes that men are supposed to be more careless than women, like, oh, just dress whatever, you know, go to school, go to work. It doesn't matter what they look like. But truthfully, Phillips Pope, in his Adonis Complex book, wrote that men in the past 25 years have risen 43% and they're dissatisfied with themselves. They're worried about things like their hair thinning, their nose shape, their acne, because they go through it just as women do. Lastly, they're also worried about their genital and muscle size, even though most women don't think about that. They engage in repetitive behaviors, is an article on PubMed said by Diaz. They will undergo, about 12% of them that have BDD will undergo 12% of them will go under acne treatment, and 7 to 15% of themselves will actually go to cosmetic surgery to change their appearance. The risk with them worried about their muscle size is called muscle dysmorphia, and it's just another part of it. They will potentially start abusing steroids, and that's how we see a lot of men who like keep working out and they're just like, I'm not bigger, I'm not big enough, and they'll abuse them, and then that just affects their whole health. Right here I have a chart that shows that it doesn't matter how old you are. You could still get BDD from ages of little, you know, being a little girl. Ideally, women feel that they have to be what they see. Ideally, women feel that they have to appear like the women's in the billboards, like the women's in the magazines. But truthfully, that perfect image is achievable by less than 5% of all women. A Swedish study shown over there in Sweden that 81% of 10-year-old girls have already dieted once because they feel unattractive and fat. And truthfully, I mean, what does a 10-year-old know about that? So they just feel this way because of the puberty. We go through it differently. Our hips widen, we start to get breasts, and we wonder, is this normal, and do I look okay? And it is okay, but some girls won't understand that, and they start to develop these thoughts like, oh, I need a diet, I need to change something, and that's just not normal. Personality traits that will make people more susceptible to BDD is perfectionism, the strive to be better than everything you are. Maybe being a little bit more shy, awkward around social situations, continue to feel less like comfortable with yourself, sensitivity to rejection, and they feel threatened more easily. Also, people who are prone to obsessive behaviors, you know, just feeling like the need to do something more. You're not clean enough, you wash your hands, your nails are bothering you because they're too long, you keep cutting them, and you don't even realize it. I hope that you can see that just about anybody can be affected by BDD. And that is why it's important to realize the symptoms that are going on in a person with BDD. So how does BDD affect a person? It affects their quality of life. Like I said, you're so consumed in your thoughts about what you look like that you're not worried about anything. You're not worried about an exam. You're not worried about going to school. You're not worried about how you're working, because most of them can't even work because they can't stand of somebody looking at them. They hate themselves. They hate their face. They will go through about 3 to 4 hours of rituals. There's a social and clinical clinic of psychology. They will excessively groom themselves. They'll be touching their hair all the time. They'll be just constantly checking their posture, checking everything they can do. And that was minimum 3-4 hours a day. They could go through it more. Right here, this girl, I actually read up about it. She's a model. She's, you know, what most people would think is beautiful, but she sees herself as having dark eyes, constantly having to put on makeup, constantly having to dye it because she sees herself so large. Her hair is not perfect to her, and she just feels like she has all these freckles, and she's constantly having to check in the mirror to see if anything's changed or see if she can find a way to hide it. These people become distant and lonely. They avoid social gatherings. They avoid being with anybody, even their own family, because they just feel like everybody's trying to judge them. Also, they avoid eye contact. They don't want to look at you. They don't want to know you're looking at them. Psychiatrist Faye Menard said about 32% of them will drop out of school just because they feel that they are too ugly to be seen by anybody at their school. Another thing that a lot of people with BDD go through is cosmetic surgeries. The Book of Psychology of Cosmetic Surgery say that they will go through either few or multiple requests to change a flaw that they may not even have. They'll go through Botox, breast augmentation. Some men even put muscles in themselves until it looks totally ridiculous and unnatural. They will go through many acne treatments, and Dr. Harold Vidal, a very well-known surgeon, he said that about 29 of his patients who had a rhinoplasty, 20.7% of them actually had BDD. The ones that went under dermatological treatments had 8.5 to 15% of BDD. 71% of the people with BDD do actually go through surgery, but only 3.6% of them feel happy with their post-operative results. The risk with going through cosmetic surgery with BDD is you're left more unhappy if you realize that by changing the size of your nose, you didn't help how you feel. You're still ugly to yourself, and that's why suicide is very high for them after that. Another importance about how it can affect BDD can affect people. American Journal of Psychiatry said that in a 1-year study of 185 people, 57.8% of them actually attempted or went through with suicide. They feel shameful, disgusted, they hate themselves, and that affects the way they achieve their personal goals. Right here, there's the man with the muscles that just looks ridiculous. There's Catwoman. She's undergone so much surgery just because she's constantly having to change herself, and that's how she looked in the beginning. The same thing with that lady. You know, they're never going to be happy because they don't realize that their appearance isn't what makes them feel the way they do. That's why some of them will go under cognitive behavioral treatment. It's possibly one of the best treatments by the National Institute for Health and Clinical Excellence. It starts by 2 types of therapies. Therapy A, which is the patient accepts that something is the problem, the nose is their problem, the size of their lips, something is their problem. So they'll form a formulation. They'll say, my preoccupation with my felt impression is that the way my nose looks, and that's why I feel shame. So they change their, they check the size of the nose, they feel angry. It's just a repetitive behavior that no matter what, they're actually still hating themselves. So then they'll go to therapy B, which they admit that their feelings of their imagined effect is not actually about their appearance. Another treatment available is pharmacotherapy, which is they take antidepressants. The antidepressants help their brain activity and to make them feel less anxious, and they'll actually take it with the cognitive behavioral. Another one is attentional training. It focuses on the negative words and behaviors like high calorie or my nose is too wide. There are certain words that make them feel like they have to be triggered into doing the repetitive behaviors before. The conclusion is that truthfully, we can all be happy in what our body looks like. And I think it's important to realize that and make someone with BDD realize that, because anybody can be affected. It just consumes your whole life. And truthfully, there are treatments available, and you don't have to feel like you're not comfortable in your own skin. You're not what your body is. You're who you are, personality-wise, and how you treat others. And that is why I think you should recognize BDD and make it an actual disorder.